I think that should work. Hey, Chris, thanks so much. Really, really grateful to you, to Liam, to Gigi, and the whole Reach Out and Read family for this invitation, the opportunity to be part of this conversation. I'm already seeing in the chat where folks are coming from, why you're here, and it's really awesome to be a part of this conversation with you all. Of the elements that, thanks for the kind introduction, and of those elements, the element I take most seriously is my role as a dad of two little ones and almost three coming next month. And so in that tone of seriousness and in honor of the traditions of Reach Out and Read, I want to begin, like my good friend Nate Chomolo, with a few dad jokes. And so why did the chicken cross the road? Because the chicken behind it didn't know how to socially distance properly. Sorry. Though the World Health Organization announced recently that dogs cannot get COVID, so they can all be released from quarantine. For the record, who let the dogs out? I am so sorry. Really, I hear the boos coming through the screen from Chris's reaction. I hear boos. I hear boos from my wife and mom here. So I apologize to you all. But no, the good news for me is I don't begin my clinic visits with jokes because I would be without a job. But I do begin my clinic visits with books. And so before I begin, I just want to take a moment to say my deep gratitude to Reach Out and Read for what you do. I, on Monday, walked into a clinic visit with a child who has had a lot of difficulties with clinic visits. And I walked in with the book and a bookmark and a couple stickers, and this child beamed. The whole visit, he was reading this book. And I can't tell you how many parents have told me that their Reach Out and Read book is the book that they love the most in the world. And I bring this up because for me, it has been such a powerful tool to build relationships with kids who may be reluctant and with families. And those relationships are the thing I value most about my job. And this topic today is trauma and COVID. However, the topic could just as well be relationships. And so for that, I just thank Reach Out and Read from the bottom of my heart. It has been a year of events, that undoubtedly can and will and may cause trauma. That we've seen death, we've been tested, we've seen death on an epic scale. We've seen racism, violence, elections, and up to and including this week with the tragic events in Atlanta. And so as we see all of that, we're all struggling. Our kids are struggling. And I want to take a moment today and we're going to reflect a little bit on what impact that may be having. But I also don't want to underestimate the power of words and the power of books to heal in that process as well. I was running at some point during the pandemic, if you can call what I do running, it's more trudging or stumbling. And I ran into something like this on the sidewalk. And then a few feet down the road, there was imprinted in the sidewalk a poem. And it read as follows: regarding, yes, you. You are the manifestation of some ancestral prayer, hope that eased them from one burden through the next, and now their prayers still cover you. Live and don't forget. This is a poem by Tio Aiken, a St. Paul resident. And it reminded me of one of my other favorite children's books, and this quote: do you have any idea how many events and choices that had to occur since the birth of the universe leading up to the making of you? Just exactly the way you are. Anybody in the chat know this book? Someone wrote, it is A Wrinkle in Time, one of my favorite books. The stars of the movie version of A Wrinkle in Time put their own memes out, and I think they captured a lot of 2020 well. It has been a trying time, and at this point, as we talk about trauma-informed care, as we talk about traumatic experiences, I would talk with learners or residents about traumatic experiences that they've had in the hospital or in the clinic, or traumatic experiences that their patients have had. I think we're all undoubtedly recognizing that we come on some common ground here with the traumatic experiences of this year. And so I hope to do the following today. I want to identify we'll talk briefly about early child development, and then some of the contributors and disruptors of that early childhood development. I want to talk about ACEs, adverse childhood experiences, and outcomes associated with those adverse childhood experiences. We'll delve into trauma and think about how trauma might have an impact on development and behavior. And then we'll double click on COVID and think about the experiences of this past year and how that might begin to affect young people. And I think importantly, I know what a lot of people want to hear is, what are the steps we can take to help mitigate for for ourselves, for our families, and for the children we work with. I want to point out, I approach this with a great deal of humility. There's a lot of experts on this call today, and so really I'm just honored to be a part of the discussion, and hopefully the discussion will help us all learn a little bit more. In fact, the reason I'm doing this presentation today is to learn more as well. Does anyone know what this place is? I'm having trouble tracking. So this place is Ellora. It's a set of caves and carvings in India. And I bring it up because it's the largest monolith carving in the world. Our friend Damien Fair, who's a Genius Grant winner, a professor at the University of Minnesota in child development, equates child development not to the building of brain architecture through Legos coming together, but rather taking an infinite potential of neuronal connections and then carving and enhancing certain connections. And so we know that child development forms in the context of relationships. The human brain requires experiences in order to develop, and that brain architecture is formed at very early ages in interactions with adults. So we talk about these serve and return experiences that children have. So when we coo at a baby, when we talk to a baby, when we make smiley faces at the baby, when we make these big facial expressions to the baby, we're serving. And then when the baby makes a sound back, they're returning. And it's through those interactions that not only do children develop neuronal connections of language, of movement, they also form strong relationships. And it's these connections, these synapses that are formed early on in the brain that form fundamental brain architecture. We also know that kids who don't get these early experiences, kids who don't get these interactions, it's very difficult to make that up in future times. And so it just emphasizes the importance of early childhood events and brain development. I'm going to talk about something called adverse childhood experiences. And it begins to portray and describe the ways in which traumatic experience or difficult experiences in early childhood may affect young people and their development. The seminal article on this topic was made in 1998 by an author named Felitti and his group. And they did a study in Southern California with 17,000 individuals, mostly upper middle class, white individuals. And they found, and they asked folks questions about experiences that they had in childhood, and then experiences and events that happened later on in their lives, including health experiences. And they found the following. They asked about questions of abuse, neglect, and household dysfunction. And so, did people have experiences with physical, emotional, or sexual abuse? Did they have experiences with physical or emotional neglect? And did they experience in their childhood things such as the mental illness of a parent? Was their mother treated violently? Was there substance abuse in the home? And then they subsequently asked about some health outcomes. What they found is this. ACEs, adverse childhood experiences, are super common. A lot of people have ACEs. And lots of people, 25% had greater than 3 ACEs, adverse childhood experiences. And what they also found through their study is that ACEs can have a long-lasting effect on health outcomes, as well as behaviors that people engage in later, and uh, things such as graduation rates, academic achievement. Multiple studies have followed, and these are the behaviors that they measured in the initial study. Was things such as smoking, alcoholism, drug use, obesity, and then things that you may not think have any relation to things that happened as a child. For example, heart disease, stroke, COPD. How do those relate to things that happen to a child? And yet what they found is that the more ACEs that people had, there was a stepwise response, and they had more of these negative health consequences. Multiple studies have followed, and what we see is that ACEs correlate to a lot of things, a lot of behaviors, and a lot of challenges that people may face later on in life. We see that ACEs correlate with teenage sexual behavior, depression, liver disease, adult alcoholism, and then something that I know we're experiencing an epidemic of right now, suicide attempts and mental health concerns. How do these events that occur in childhood have long-term effects? I'll say that the studies are still ongoing, but there have been some strong hypotheses as to how this can happen. Looking here, we see that young people with adverse childhood experiences do and may have some social, emotional, and cognitive challenges early on in life. And we're going to delve into this a little bit deeper later on. Those challenges early on in life can lead to the adaptation or the adoption of risky healthcare behaviors. With risky healthcare behaviors leads to earlier disease, and earlier disease can lead to earlier death. Now, I think it's super important to think about on the right side of this that ACEs don't happen in vacuums, right? ACEs are left to us by generations before and are very subject to intergenerational trauma, racism, bias, and historical forces that lead people to have more ACEs and more challenges. So just keeping that always in mind. Now, ACEs, it's an ongoing area of research, and some of our colleagues in Philadelphia, as well as in other places in the country, are looking at other ACEs, other things that happen to children at young ages that can have long-term effects on healthcare. And our colleagues in Philadelphia in particular are looking at this broad, more community level adversity questionnaire. So looking at, have you experienced racism? Have you been treated badly because of your race or ethnicity? Have you been witness to violence or lived in the foster care system? And so this is an ongoing area of research, but there's some really interesting and important tools being developed to address the really wide variety of things that can cause trauma and challenge to young people. I do want to now delve into a little bit around trauma. So what is trauma? When I think about trauma, I think about 3 different things. I think, what is the event that happened? How is that experienced? And then what is the effect of that experience on a child or an adult? So the event can be a frightening, dangerous, or violent event. And that event can be experienced either as experiencing it, witnessing it, or hearing about it. There's multiple ways to experience a particular event. And then long-term, when we think about trauma, we think about it overwhelming a child's ability or an adult's ability to cope. And that can be a physiological response as well as a long-term psychological response. I want to make clear, stress is not trauma. I think about every day in clinic, we put kids through a stressful situation. We poke them, we prod them, and we give them vaccines. It's a stressful situation for any baby. But in the vast majority of those situations, there's a parent there or a family member there who comforts that child, who mediates, who is an adult, who helps the child through that difficult experience and shows them that this relationship is healing and that things will get better. Such a profound moment. And I congratulate every mom and dad who is there, or parent or guardian who's there for being there, support their child through what is a difficult experience. So you can have positive stresses. You can have stresses that, like a school test or a sports game where your heart rate and blood pressure go up a little bit and you're able to perform in the way that you want. Tolerable stressful situations are when they're buffered through a relationship, a parent or a guardian, a caring relationship. When children or young people are exposed to these toxic or stressful situations for a long time, multiple times, challenging experiences over the long haul without that mediation, that's when we can begin to see toxic stress and the long-term consequences. And so you can see here, it is really a spectrum, but one of the key elements is there that caregiver to mediate and buffer? Just again, I want to emphasize, trauma can be acute. It can be one episode. It can be complex over the course of a long time. It can also be predicated on historical, generational, and community trauma, as well as systemic harm and racism. Calling out and just thinking, we know some communities who we have the privilege of working with have a higher propensity towards traumatic experiences and trauma based on history as well as current situations. And so here are some of the groups that we know of have a higher rate of experiencing trauma. Sort of evolutionarily, when a stressful situation happened, we wanted to respond adequately, right? Whether it's a violent attack or an animal or whatever it might be, you wanted your eyes to open up bigger, you wanted to run faster, you wanted to get more oxygen, you wanted to breathe bigger. And so when you think about a child who is at rest and then a threat happens, we all have that fight or flight response, that sympathetic response. What we would like is for that to recover and calm down. But for children and adults who experience a lot of chronic stress, a lot of adversity, a lot of ACEs, you reset that barometer. And so the sympathetic drive comes out more quickly, more readily. You have a higher steroid cortisol response, and you see a different allostatic load for individuals who have experienced chronic stress. When I think about that trauma then affecting babies and sort of thinking about long-term development, the model that's sort of been developed is that early trauma, early complexity and challenge can interrupt sort of very basal actions such as sleeping, eating, the basic fundamentals, and maybe moreover, the connection between a baby and a mother or a baby and a family member. Without those connectivities, without those skills of sleeping and eating correctly, we start to see sort of challenges in terms of emotional functioning. That can be perceived as delayed milestones. It can be perceived as sensitivity to loss, fear of abandonment, weakened response to cues. What we see then in later educational terms when it comes to schools is, whether that's schools or pediatricians or community members, we start to say, oh, that's behavioral challenges, or, sometimes we call it misdiagnose ADHD, depression, autism. And we see a lot of kids have then learning challenges, difficulties focusing, as well as difficulty making relationships. And then long term, kids who have those challenges bring some of those skills back into their own parenting. And so how do you stay in control of your emotions? How do you not have a sympathetic response when kids are doing things that are really challenging and really frustrating? How do you still stay calm? And so we see that in terms of a developmental progression. How do ACEs correlate to this? Well, we know that children with high number of ACEs, greater than 3 ACEs, have greater attendance issues, greater academic failure. We know that kids with greater than 3 ACEs have much lower rates of graduating high school, much higher rates of being involved in court, having long-term adult adversity, as in involvement with the criminal justice system, or mental illness, violence. And then this is carried over because we know that adults with greater than 5 ACEs are 14 times more likely to have 2 or more conditions that then go on to their children. So it is something that is a multi-generational issue. I think it's just important for us to stop for a moment and think, what are some of those trauma response signs? And this is when we think about it with residents, we think about what are we seeing? What are we seeing from patients, from young teenagers who may be hospitalized, or from parents? And how do we see it in ourselves as well? What are our responses to challenging or traumatic experiences? Things like blowing up when corrected, fighting when criticized or teased, a quick response to fighting, reckless or quote unquote self-destructive behavior. But then we can also see it in manifest in different ways: nightmares, sleeping problems, feeling very sad, angry, and then we can also see it in a really psychological sense in terms of difficulty imagining the future. And that's a huge one when it comes to the mental health crisis our community is facing right now. We talked a little bit about sort of generalized trauma. I want to focus a little bit now for the next couple minutes on COVID and what are we seeing, or what are we potentially seeing? What are we hearing? I think the question of what has been the effect of this pandemic on parents and child psychological well-being, probably anecdotally can be answered as really challenging, right? Like, I think we can answer that. But then the question becomes is, what are parents experiencing, or what are families experiencing, and how does that relate to adult and child mental health? Gaspin Pines did a really interesting study. They actually started in the first couple months of this pandemic. So this data is all from early on in the pandemic, February to April. Right, so right at the end of February to April. And they were actually planning on doing another study, but they were surveying working class individuals in the southern United States who had children between the ages of 3 and 7. And they first asked some general questions about what are people experiencing. And what we know is that income loss of jobs, added caregiving burden, illness itself, as well as stressors on mental health of parents, are some of the things that were highlighted. Parents are experiencing, and you can see a sizable percentage, and this is in a year ago, people were experiencing this rate of income loss as well as caregiving burden. And we see that after the restrictions, particularly in terms of outcomes, parents were having more negative mood. Parents were working a lot less and had more disruption in their workday. They didn't see a statistical difference yet in child uncooperative behavior or child mental health at the time. One interesting thing, though, is this too proved to be stepwise in relationship. The more of these things that you had, the more challenging mental health consequences were for your family. So if you had any one of these, we saw parental negative mood. So parents were in a worse mood. If you had any 2 of these, you started to see not only negative mood, you start to see changes in physiology in terms of sleep, and you start to see some behavioral changes in kids, or at least the parental perception of that behavior of the kids, more uncooperative behavior. So any 2 of these elements, income loss of job, you start to see all this. And then if you had all 4 of those, you began to see a real toll on the way that children think as well. So we see a stepwise relationship again. The more adversity that you are experiencing as a family, the greater the mental health consequences. Araujo et al., they did a study more recently, and they looked back at some studies on COVID, but they also looked at H1N1, AIDS, Ebola, and looked through pandemic literature and started to say, what are the things that families are experiencing? And things that many of you are watching and witnessing and helping families through: fear, illness, isolation, financial challenges. And I think this is so key, is the parental mental illness and maternal anxiety is what they identified. Parents are not well, right? And one of the things that we know is we need healthy parents to help mediate stressful situations. And yet that's not what we have right now. And so a huge challenge. They go on to say, to the high level of stress that humanity is experiencing as a result of the COVID-19 pandemic may generate tolerable or toxic stress for children and adolescents, depending on if and how support is ensured. Under the appropriate care of adults who are doing well, who provide children with constant feelings of security and affection, the child will reorganize. However, when this is not present, we will see toxic stress and the physiological and mental health consequences thereof. This has been apparent in our CDC data. So the next few slides, I'm going to show you CDC data. First, on child abuse, we are seeing the solid line on this slide is 2020. The less solid line is 2019. And you see that there's a far higher proportion of ER visits for child abuse. And over here, that a far higher percentage of those are being admitted to the hospital. So while overall ER visits are down, we're still seeing a lot of child abuse. When it comes to mental health, and this is something that I'm sure Gigi will speak to as well, is we're not seeing kids right now all that much admitted for respiratory viral illness, right? We're seeing a ton of kids being admitted for mental health and suicide attempts. And so what we're seeing is a higher proportion. Now in this one, the dotted line is 2020. The proportion of kids of ER visits that are for mental health is astonishingly high. So what can be done? And I'm sure that's a question that we all have. So I think about it in two respects. One is what can be done systemically by systems, and what can be done by us as individuals. When it comes to systemic work, I think first and foremost, us realizing that we are living in traumatic times or potentially traumatic times, that the people around us are having traumatic reactions and experiences, and we need to realize that. We need to realize the way that trauma from years ago and trauma from today are impacting our parents, our children, and all of our colleagues and family members as well. We need to recognize these signs. We need to respond systemically by incorporating knowledge of trauma and making systemic steps towards responding appropriately. And I think this is a huge one, is resisting. We need to introspect about our institutional practices and avoid re-traumatizing, particularly in the context of things going on today. I put up this next slide because these are the principles that SAMHSA, our mental health organization, would advocate we use in terms of programming. I don't want to go into it deeply, but just look at all the words: safety, trustworthiness, peer support, collaboration. It's all about relationship building, right? This is all about how are we forming relationships with patients, with families, with clients, with the folks we serve. I love this slide. Pathways to resilience. So one of the things I think about is, first and foremost, we need adults to begin to seek mental health, identify emotional triggers, create safe relationships, and we need adults to be well or better. And then we need to sort of turn our attention to kids and look at all the words under kids. It is about, are we increasing connectivity? And so one of the questions I think we should all be pondering is every child we're serving connected to someone And are we connecting children to someone if they need it? So that's huge. And then everything in the middle, if we think about healthy food, if we think about music, art, a lot of things that have been cut, frankly, during the pandemic, are we as a society investing in these things that support and heal? In the context of the pandemic, I love this picture. In the context of the pandemic specifically, I think a couple of questions that I ask and that we can do for kids. One, put them in control, give them agency in the ways that we can. So these young people are wearing masks. They're not socially distancing, but by offering the chance for kids to socially distance, wash their hands, wear masks, be an agent of stopping spread, empowering them in what ways we can. We've talked about the signs of anxiety and nerves. We should encourage all parents to be great examples. This is a challenging time. Are we reaching out? Are we getting mental health support for ourselves? Are we getting support for ourselves? And so I think that is huge. And then this is a big one too. Routines, rituals build resilience. So we are teaching kids, we're giving them the blueprint for how we deal with bad events. If we make things such as the daily walk or meals or conversations, daily conversation check-ins about how people are feeling, if we do those types of things every day, those are the rituals that will follow our young people on to the next, God forbid a pandemic, but whatever it may be, whatever the next great challenge is. And then finally, I talk about what Mr. Rogers talks about and being a helper, and when bad things happen, how can we empower our kids to be helpers in challenging situations. Christina Bethel, a colleague of ours out at Hopkins, asked the question, all right, so we know adverse childhood experiences have negative consequences on the health of young people. What about positive connections and positive experiences? Do those have some effect on the health of young people? And they did a study in adolescents. So it doesn't quite pertain to the smallest of kids, but I think the idea is there. And they asked, are you able to connect to family, to friends, to community traditions? And what they found was stepwise. The more connectivity you had, the more protected you were against mental health consequences and mental health challenges. The brain develops in the context of relationships, and the quality of early experiences matter. And I said this would be a talk about relationships, and I think fundamentally it is. How are we inculcating them? How are we engendering them? Before I finish, I will just give you a brief preview of what we're doing at Hennepin. I'm really honored to be a very, very small part of the Mother Baby Redleaf team. Mother Baby was a program started by Dr. Helen Kim, over 10 years ago now. And it's a program that works with moms who have mental health concerns, substance abuse concerns, moms with experiences of trauma. And as we think about it, right, going back to this slide about what can we do to help families and children address trauma, part of it is addressing adults' trauma. So this is what Mother Baby does. It acknowledges the trauma of individuals. It works on their mental health concerns. It creates stable relationships. And by helping moms heal, you're doing the upstream work for the baby and the child. So recognizing that this is a multi-generational process. And then I'm really honored too to be a part of the Redleaf Center, which is taking what Mother Baby has done and now saying, how do we do that for whole families? How do we do that for sort of everyone involved in a child's life? And so really honored to be a part of that, and I'm sure we'll get into some discussion. Homework for everyone here. If you just want to feel good about life and about the world, and I know we all can use a little bit of that, Google or YouTube Oprah 60 Minutes Trauma. It's a beautiful piece she does on trauma-informed care and about her own healing and recovery. And so I won't take the time to play it today, but I do encourage you all to cap your week with that. The Velveteen Rabbit, as Chris said, is my favorite book. It's about a rabbit who experiences tough times. Is a little tattered and battered and has gone through challenges, but ultimately the skin horse says, you know, what does it take to be real? It's a thing that happens when a child loves you. And real is a thing that happens when adults love children through the traumas, through the pangs, and through the pain. That love is redemptive. And so I'll stop there. Really excited to engage in a discussion with you all. Thank you.
Thank you so much, Dr. Krish. And if you wanted to stop sharing your screen, you can do
Sure.
that so we can kind of open it up a little bit. Thank you so much. There's so much. I always feel bad when I'm not on camera because, you know, I think behind the scenes we're nodding and we're, you know, so much is resonating that you know, you don't get to see. There's a lot of discussion in the chat section, and there's also a couple questions in the chat and in the Q&A, but I'm going to give it over to Gigi to kind of comment and provide her own perspective.
Great. Well, thank you, Krish. What an amazing presentation. You're such a gifted speaker, and this is such an important topic. It's such a big and weighty topic, and I thought you just did a wonderful job at helping break it down for us. So thank you for that. I think I'll lead off with questions, if that's okay.
Awesome. Yeah,
you know, so much of trauma-informed care is personal. And where do you see that we can all do this work? You know, there's so much work to do, but do you see it as work that needs to start at an individual to individual level, or work that should take place at a system level? Or how do you see that work of really doing trauma-informed care well happening?
Yeah, thanks, Gigi. I was on a conversation this last weekend with a college professor of mine, and they were going through some really amazing discussions about the power of intentional conversations, intentional relationship building, and it was really beautiful stuff. And then someone asked, how do we scale this? And it's a really important question, but I recalled, I was really privileged to hear one of the mothers of one of the beautiful children lost at Sandy Hook gave a grand rounds once, and she recalled being asked that question about scaling. And she works with young people who have gone through traumatic experiences, and she said, "This is such hard work. It's such heartfelt work and hard work that really I'm so focused on this." This act of creating relationships, of creating moments for young people, that I can't even begin to think about how to scale. That's not my perception right now. I'm going to do this work really, really hard, and I'm going to leave it to other people to scale, right? And so in some ways, Gigi, I'm really excited to talk to someone like yourself who is in a position where you can start to think about how you scale some of this. But my takeaway on that was, I think leaders of organizations really get the power and the capacity to say, how are we capacitating relationship building at every single level? Reach out and read, you all do this every day, right? Like you think about, how do we build a relationship? I really think that's what leaders should be charged with. Now, there are steps, right? Like, and I think there's really important stuff being done. I think it takes deep listening, and I would put communities at the center and at the heart and at the leadership at every space of this process. Listen, 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 listen. And hear where we are traumatizing patients. Hear where we are traumatizing families. Hear what are the many missteps. Because I think that do no harm piece, the resist re-traumatizing, is so important. So I would begin by listening, 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 listening. And then I would go to that first R, which is recognizing. And then I think it takes really aggressive campaigns of just informing people about the ways that trauma is present in all of our lives, And I mean that not as clients or patients, I mean in our lives as providers, as people living on earth right now, right? Like, how are we taking care of our staff? How are we taking care of our community in healing ways? So I go a little out of order on the R's. I really think it's resist, stop, do no harm, and then recognizing trauma in all of our lives. I think once we begin to realize that trauma plays in my life and all of our lives, it is easier to bring cultural change for systemic change. But that's my thought. But I'd love to hear from you too, Gigi. So,
I wonder if you might highlight a little bit of the work that Hennepin Healthcare and you and your teams have done with my friend Helen Kim, who you referenced earlier too, for sanctuary care at Hennepin.
Well, Dr. Kim's a genius, and I'll just throw it out there. I mean, and not a genius, and she is a genius. She's also a visionary, right? And she's like a visionary who leads with heart. And I think that's a big deal. She's really thought interest. So she recognized the way that trauma was affecting her patients. She's really constructed programming to resist re-traumatization. And then she's really gone ahead and helped our whole institution. And I give credit to Helen as well as a lot of other people at the institution to say, to do that introspective thought about listening and hearing how we've done wrong, right? Like, what are the ways that we're doing wrong on a daily basis? And so, yeah, I think her recognition that this is a multi-generational challenge and we need to address both generations at the same time. And so I just think that the opportunities for collaboration are so great, right? Like I'm a pediatrician, I rarely get to talk. I rarely did talk with our psychiatry colleagues about parents, right? Like that's just not, and so I think what Dr. Kim has done is just recognized and resisted, but then has broken down silos, and said, we need to, if we're going to get to the bottom of this, we need to start bringing all this care together. So,
yeah, I think, you know, just to shout out to Dr. Kim, you know, she's really worked with all of Hennepin Healthcare and employee, employees, just to make sure it's part of the fundamental training for every employee at Hennepin Healthcare. So if Hennepin can do it, I know, you know, they're a great resource. We all should be able to do it.
Absolutely. It's a real blessing to have that kind of teaching, knowledge, and emphasis from leadership, right? To have leadership saying, these are really important things and we're going to get better at it. We recognize our faults and we're going to get better at it. That is huge. And that's the first step.
So I'm just going to take a couple questions from the participants. And I think, Krish, you just sort of addressed one, but the first question was, are Hennepin Health and Children's Minnesota providing ACEs education and trauma-informed compassionate care for new and current employees? It sounds like yes at Hennepin.
Trauma-informed care, yes. I don't know if we've done explicit ACEs specifically for all our employees. So I'll look into that. Thanks for the prompt. But
we've rolled out some ACEs screening at Children's Minnesota in our Healthy Steps program, which works with our urban primary care clinics. And, you know, specifically for parents, looking at some of their ACEs in the context of a well child visit with a, you know, kind of a psychologist involved, or a Healthy Steps worker and a pediatrician. It has thus far been a very positive and engaging experience for our patients. Definitely hard work.
Another question, are there any standardized screening tools for trauma out there that can be incorporated into routine well child care? If not, are you aware of any being developed?
Oh, I love this question. And I know Gigi and I will talk about this for a long time. There are. So I would encourage folks to look at Nadine Burke-Harris's work and the work out in California. There's a couple screening tools that use ACE work. So there's PEARLS, it's called PEARLS, but I don't know what that stands for. But PEARLS is a tool that can be used to begin doing ACE screening. I think Gigi's, at Children's, they've done a slightly different work than we have. We've sort of erred on the side of doing sort of really standardizing our social determinants of health screening and working from that perspective, as opposed to doing a screening for all our well child checks. That is sort of under the auspices of how are we going to intervene and what is our intervention going to be. That's been our sort of mindset. I will say that in Dr. Kim's program, in the mother-baby program, they do ACE screening. And they do that, and then they have really intentional conversations, right? And really long-term relationship building around the answers to those questions. Because as you can imagine, having conversation or talking about your ACEs and not doing that in a sort of structured manner can sometimes be re-traumatizing or challenging. So, so I guess to summarize, we are thinking about a lot of the elements that contribute to ACEs, but we're doing it from sort of a social determinants of health standpoint. I'll just throw out a couple of healthy steps, healthy leads, are a couple tools out there. There's a number more, and I'd be happy to send Chris a link to like a bunch of different screeners. But Gigi, I know you guys have taken a slightly different take on that.
Yeah, I think we've created our own social determinants of health screener, and then have that's universal, and then put in some ACEs screening for populations in our Healthy Steps program. So I think that's how we've approached it thus far.
I will say that one thing that we've done, and we're excited to, it sounds like we're going to be able to relaunch this post-COVID in a couple months. We've been able to bring in mental health practitioners. We've always had sort of a co-located model for kids' mental health, but we're now able to bring back, and we did a pilot of this, but we're going to be bringing back mental health care practitioners for parents. So around parent coaching, as well as when we recognize that parents are having mental health concerns, we're bringing that back into our clinic and having that resource available. So we found that once again, that multi-generational process is valuable to our parents and to us.
Great, thank you. We'll do one last question and then we'll wrap it up. So the commenter question, the person who had a question said, taking care of adults is important to the well-being of the family and child, similar to what the Father Project is doing. Is there something the businesses should do? So I take that to mean sort of community businesses. This is a problem with the same magnitude as climate change, isn't it? So that's a big question, but either one of you want to tackle that?
Well, I think any opportunity we can do, like recognizing, if we as a business community recognize that people come from trauma, right? We all come from trauma, and some people more so. One, sort of recognizing that and being graceful with that in mind. And then like things like the Father Project, right? Like businesses and their incorporation of like giving opportunities to folks who may have had challenges early on in life. I mean, that's a big deal. And you saw the impact from the Gassman-Pine study. Loss of job and loss of income led to great mental health concerns, leading to family distress. So I think that to the extent that business partners can play a role in supporting our moms, dads, family members to have meaningful employment, I mean, that's huge. I don't know, Gigi, any other thoughts in that, please?
No, I think you really summed that up well. I think it does take everyone kind of thinking about this, having common language, and being willing to have dialogue and just being graceful with everyone. I think that's exactly right. I would just love to add one little piece. Children's is engaged with the Harvard Center of the Developing Child on toxic stress research, which ACEs screen the parent and that dyad relationship with their that multi-generational relationship. But one of the screenings that we're thinking and working with the Harvard Center is really, can we screen the infant by detecting elevated cortisol levels, and therefore looking at which children are really going to be affected by toxic stress and head down this cascade versus those who may be under a dyad relationship with an elevated ACE, but actually not be affected. So I think it will be really interesting as pediatricians moving forward if we could really detect which ones of our patients are suffering the most with toxic stress, and then intervene there.
Well, Gigi, that's awesome, and looking forward to seeing what you guys implement and learning, because that's a huge step.
Well, thanks to everyone joining us. There were a lot of sort of comments and resources in the chat. So for everyone who was registered, we will send that out after this. Yeah, lots of good stuff in the chat that we'll kind of compile and send out. And if anyone has further questions that didn't get answered, feel free to funnel them to us at Reach Out and Read, and we can reach out and get answers for you. But a huge thank you to you, Dr. Krish, for being our special guest today. We loved having you. Lots of praise for you in the comments, Dr. Krish.
My gratitude once again to you guys, and to Reach Out and Read, and to some incredible people serving children all over this chat. So thank you all.
Thank you, and lots of interest in the Redleaf program, which yes, I would absolutely encourage you guys to check that out. It sounds absolutely amazing, and thank you to Dr. Gigi. All right, everyone have a great day and a great weekend.